And can neurological symptoms first appear after the cancer is identified and after surgery?
It can. Usually it does not happen that way. However, I have seen cases where cancer was diagnosed and then later, no matter how much hard I tried to kind of track back and understand were there any subtle symptoms, but after the cancer diagnosis we had sort of more elicible symptoms. Some of these patients, it's many months or years after, and at least we've had a handful of patients where it is a sign of cancer recurrence. This cancer was diagnosed, was treated, and then 5 years down the line, patients started developing some, or 2 years down the line, started developing some walking difficulty, syndromes suggestive of brainstem or cerebellar involvement. We evaluated the patient again, rescanned the patient, and found that the cancer was back. And that is what was triggering the paraneoplastic syndrome.
In any case, we get back to, if you're having symptoms and you don't tell your doctor about it, whether it's before or after the surgery, the doctor's not going to know about it.
That's correct. And I would like to emphasize that especially patients who have cancer, if they start developing some of these neurological syndromes like the ones we talked about, or if they had symptoms even prior to the cancer diagnosis but was not given a name, those patients are the ones we should be very careful in terms of reassessing. Is there a role of paraneoplastic autoimmunity which was triggering these neurological factors even before the cancer was detected?
Do you think it's possible at the intake level or even the nursing level to have questionnaires or have things that could be designed to elicit information like that?
I think so. It would be challenging to some extent because how rare these conditions are. I'm not sure if we start including questionnaire in every patient, how many patients we'll find. However, in certain high-risk groups, I think these questionnaires are going to be very useful. And that high-risk group I'm talking about are patients who have cancer and now are scheduled to receive immune checkpoint inhibitors.